Dave Baden, thank you so much for carving out time in your busy schedule to answer these questions.
Great. Look forward to it.
Yeah. So what have been the biggest challenges of the rollout?
Yeah, no, it's amazing to think that we're just over 6 months since the first vaccines have arrived into the state, and just the amazing feat of science and engineering to get to this point. As we all talked about how long it usually takes for a vaccine to be developed and the normal process, and the history of vaccines and the eggs it takes to make typical flu vaccine. But then you can see the power of technology and the power of engineering and ingenuity to get vaccines to this point with a lot more money than normally gets put into developing a vaccine. So I mean, I think that the biggest challenges of the rollout probably have changed, throughout the rollout. But having a product that has extraordinarily high demand while supply is scarce is difficult to manage for all of us, and for our healthcare system partners, for the Oregon Health Authority, for those that wanted it. I would have loved to be able to have opened up and turned on the full vaccine spigot on January 1st. We weren't able to do that. We weren't able to do that on February 1st. We weren't able to do that really until now, to where sort of the supply and demand quotient has shifted. And I think that has been a really big challenge of the market, or of the rollout. I think just at the beginning, and especially for our hospital partners that really stepped up, understanding the storage and the pharmacy and the administration of this product, of a 2-dose vaccine, was, I think, underappreciated going into this. And having something that needed ultra cold storage, how to turn that on a daily basis, that was not something that a hospital normally deals with on a daily basis. And I think just getting used to that was definitely a challenge in the rollout. And I think the thing, in looking back at the past 6 months, I think the piece that I wish we would have thought about and done differently and been better prepared for, was a better equitable distribution of the vaccine that that really got to all Oregonians, regardless of economic status, regardless of whether they're a Black or a brown Oregonian. I mean, the impact of the pandemic on communities of color, and where the pandemic raged most in Oregon and across the country, were in those communities. And we did not do a good enough job to assure that there was access from the very beginning to those communities. And it shows in the gap that we have in vaccination between between a person of color and of not in the pandemic.
Well, so that leads me to the second question. I know a lot of people have wondered how the allocations were made, and I know it was very difficult to make those decisions, especially early on when demand was high and supply was scarce. But can you just briefly give people a sense of how those decisions were made?
Sure. And this definitely is one that I think evolved over the first few months of the response. At first, remembering where vaccine was initially headed to was to healthcare settings, hospitals, to vaccinate frontline heroes in the pandemic response in the healthcare infrastructure of the state. And there were surveys that were used to base that data. I think from there is where it got more complicated, because hospitals and health systems that pivoted from vaccinating their own staff, which may be challenging, is way less challenging than operating a very large, high throughput mass vaccination site for the state. And so that pivot I think led to a, sort of a change in how the weekly allocations were done. It started to, really focus where weekly allocations were where people could get doses in arms. And, that led to probably doses going not in a consistent fashion in January and February across the state. It really went to places that we knew had the capacity to move doses in arms quickly. So I think from when we got into February, I think we all knew that we had to fix that. And, we moved into a little bit more of assuring that there were doses going across the state, because as we got into February, more and more places figured out how to, to give this vaccine. It was a little slower than I think all of us maybe have wanted. But as we got through February, we were able to turn on a little bit more consistent spigot. Now, it was a spigot that was slow. It was not meeting the demand in the Oregon Convention Center or at, the Salem Fairgrounds, for example. But we wanted to assure that, someone in Morrow County had basically a per capita equal chance of being able to get a vaccination appointment than someone in Portland. That meant basically everybody was mad, but at least I could go back on a consistent formula that said, hey, I get that may only mean 100 doses go to Morrow County, but that's what your per capita demands with how much vaccine that we were getting. If I had double the vaccine, I would be able to send double the doses. And I think it took a little bit for that to get through, but so what that allowed then is a little bit more data-driven policy of where vaccine doses were sent every week. And as we've gotten through the next few months, we were able to use more inventory data and other things to manage allocations. And now we're basically into a model where a vaccine provider is able to order the vaccine that they need when they need it. So we're past the point of a weekly allocation process and more in, if you're a vaccine provider, you have some vaccine in your fridge. When it looks like you're running out, you order more. It should be there in 2 or 3 days. It's just a very different place than where we were, but it gets back to sort of, in some ways, a little bit more normalcy in how medical supplies typically are ordered. Period.
Yeah. So this next question, some of it's unknowable because the production ramped up, but I'm just curious, and a lot of people are, has there been a difference in dealing with the current administration versus the previous one in terms of, because I know you had a few weeks from the previous one, did that change in the tone and how this was all being handled?
I do think that there's, a little bit better collaboration with the states, listening to some concerns about the rollout. I think you did point out, obviously the, having more doses available as we got through the end of January, February, and March, and in some cases led to a little bit of rising tide lifts all boats. There were definitely still some concerns that that we brought up. Really based on data, Oregon's per capita share of doses that we were getting in February, March, and April still weren't adequate. We ended up being sort of for a while, sort of the 49th state and per capita doses that we were getting at one point. And, so we brought those and got an explanation. Nothing changed. We didn't get magically more doses, but really at that time, we were starting to switch into where everybody was eligible, and then allow us to change how things were done. But I think having more vaccine, I think that there have been more support. The fact that we did end up getting a Federal Emergency Management Agency site in Jackson County for a while, I think was helpful. And FEMA has been very helpful of supporting sites also throughout the state.
Mhm. Yet here we are. We're now in June, and we're well over half the state being vaccinated. And
Right.
how does that feel? That has to feel good.
Yeah, no, I mean it does feel good, and in being able to to get to where we're at, knocking on the door of 70% of 18 and older being at least receiving one dose. I would have loved to see demand not slow down as rapidly as it did, and I think that's really where we're at is from where people are really seeking vaccine to where we need to seek people out to get vaccinated, and that's just such a change to where we are at. So yeah, no, I think I think generally, and with I think great partnerships with the healthcare industry, I think with local public health agencies, Oregon is, as bad as the pandemic is and as tragic as it has been, Oregon has been one of the better places to be in the United States. We've had a lower infection rate generally. Our death rate is much lower than most other states, and we are 18th in our vaccination rate now overall. So I think generally it's you have more chance to be alive if you are in Oregon in this pandemic than if you were in other places. And I think that really is a testament to to the hard work of everyone out there, and really to all Oregonians who did put on a mask when asked, who did social distance, who quarantined when they were sick, and who did not spread the virus as much as other places.
Mm-hmm. Well, as you mentioned, now the work is harder though, getting those doses and targeting the people and getting distributed in an equitable way. How do you do that and reassure people and overcome some of the hesitancy? I know messaging is not necessarily your area, but I think having the vaccine availability is, so those go hand in hand.
Yeah. No, I think that it's so multifold, and there are so many different reasons why people have made a choice not to get vaccinated. And I think the piece that I've been reflecting on, every COVID death is a tragedy. I think the COVID deaths in the last few weeks are even more of a tragedy, and because the 98% of or 92%, I think, of those that have died were unvaccinated, or had not been fully vaccinated. It just points to where we are in the pandemic is, vaccines save lives, but there's a lot of people for lots of different reasons who, don't trust the messenger, don't trust the government, don't believe their doctor, don't believe their county commissioner, don't believe the governor, don't believe the president. So, I think the switch from the messenger and really figuring out more opportunities where someone who may get their news from a source that doesn't believe in the vaccine, or see social media posts that really bring questions out that aren't true about side effects. That person may also go see the doctor, and although they may not trust their doctor either, that's where I think over the next course of weeks and months of building in opportunities for having those conversations with their provider, I think that is an important part of this. It will be slow. I think it will be painful. I think that will help in some areas. And then I think, Dave, you hit it on bringing new access points and assure that there are more and more places for where there are people who just that are busy, have two jobs, have a very busy family life, and can't afford to take a day off work to go get vaccinated or be prepared for the side effects, which could allow them or mean that they would miss another day of work. So having more and more opportunities for for those people to have places to get vaccinated. It could be at the market, it could be at a game, it could be lots of different places where, you know what, they had an extra day and they're like, you know what, I'm going to get vaccinated now. So, you know, opening up more and more of those opportunities, you know, that we were going through a presentation today, for example, in one of the, I think, successes in Jackson County with the FEMA site is it was more than just a set site. There was a lot of mobile capacity that was brought with that. And, you know, they went and set up at a market that primarily sees Latino, Latinx, Hispanic community. And just watching the rate every Sunday of when people would get vaccinated, it's when people actually had their day off. And, you know, having that vaccine there, it was, you know, like, you know, 10 or 15 people and then 100 people. And then the rest of the week was 10 or 15 people and then 100 people. And that's what's going to happen. And so I think that, you know, reassurance messages, having trusted messengers in many, you know, places, their community organization or somebody that they're affiliated with makes a lot of sense. And then it will be the slog in doctors' offices and the people that I think, as we've talked about, that are really vaccine obstinate. What will it take to convince them? I'm not sure. I think the country is grappling with, you know, people that have said, I will not get vaccinated under any circumstances. Maybe their doctor can convince them. Maybe they'll see one of their friends get sick, who also is unvaccinated. I would really love for that not be the reason for someone to need to get vaccinated and finally say, you know what, I see that happening. I think that has been a trigger in some, you know, with the recent amount of new cases, you know, and talking with especially some of the rural Oregon counties, I think where people said, I saw this community leader get sick, or I heard about a pastor that got sick, and that drove them to get vaccinated. I think, unfortunately, that may still happen in some areas where the vaccine rate is really low.
Yeah. Yeah, and yet, you know, I know I'm sure you're aware of these too, but I've become aware of, for instance, in Clatsop County, where this sort of really creative, smart, energetic outreach effort with local employers and, you know, community partners, and they're working with, you know, out there, you know, some of the biggest employers are, you know, the seafood canneries, and they're working with those places to make the vaccine available. How important have these partners, hospitals and other organizations, been in this effort for you?
Yeah, they've been super important and such a linchpin of the, I think, the vaccination effort in Oregon. Yeah, I mean, I think I sort of see it as a little bit of a three-legged stool in what we have going forward. We've got you know, community partners, you know, that, you know, have either a trusted voice or, you know, have a group that they work with, and, you know, providing funding and encouraging community-based organizations to, you know, to get out there, to be a trusted messenger, to partner with probably the second leg of the stool, which is the vaccinator, which is whether it's a hospital employee or you know, pharmacist or doctor. That piece is, I mean, you have to find somebody to put the needle in arms, and we broaden eligibility for those that can do it. But again, that having sort of people connected there. And I think the third part, really, I think you've hit it, is a bit on where people work or where people play or go to shop, and sort of that sort of third stool of how to get people vaccinated. It's you know, really needing all parties to play a role going forward. And, you know, again, I think the role that hospitals you know, played in stepping up beyond vaccinating just their employees in their local communities to, you know, to say, you know what, the state needs us now, and, you know, we are going to take a risk and set up these things that we don't know how we're going to get paid for. We don't know how exactly they're going to happen. And, you know, they have been really, really successful in, keeping the state going in this vaccination effort.
Yeah. You alluded to this earlier, but there were so many unknowns, especially at the beginning of the rollout. Your job was very difficult because of that, with supply and at the beginning, and there were still questions about efficacy and all sorts of things. How did that again affect where you sent doses and just how you dealt with the distribution process?
Yeah, I mean, I think the beginning was, was really tough of, just people, again, figuring out how to manage, a new product, the setup, how the filling the vials would work, all the pieces that goes with just managing a new, a new vaccine or a new drug. I think there was just so much pressure right at the very beginning that was a difficult thing, I think, to manage. I mean, I think that the pieces of the rollout then of managing not just the supply, but then trying to manage the demand of different eligibility categories also, I think, is difficult. And, I think looking back, and, I think there will be a lot of medical ethicists and other looks of, wait, how we did the vaccine rollout, even from the CDC categories of the 1A and 1B, and of course, understanding that, trying to get healthcare workers, vaccinated. But I think that there's a lot of thinking and questions about where to go. And I think one thing for us that I think we wish we would have had more community guidance, and the Vaccine Advisory Committee should have started earlier than it did. And I think looking back, we should have had that going in the fall, and really ready to go, and having thoughtful guidance to help get vaccine ready for all Oregonians and all populations of Oregonians. And I mean, I think all states, I think, suffered from some of the same concerns. But I think it is one thing that we definitely could have done better.
Yeah, well, sure. At the same time, I'm sure you maybe have had the thought at the time of, it would be really great if we had this really connected, well-funded public health infrastructure, and I can just get the supply and just kind of plug it in. And people are oriented towards getting things that way, and that's how it's going to work. And yet, that's just not how we have set up public health in this country.
Yeah, no, I think you've hit. I mean, on it, the non-interconnected, probably a better term than that. The disjointed nature of the healthcare system. I think the pandemic has really shown where there are very, very strong disconnects. There were thoughtful plans and preparedness exercises done between hospitals and health systems and local public health. And I think in where those were strong, I think you saw some benefit of that in how a pandemic response rolled out in a certain county. But even, if you sort of take a step back, and the fact that there's not sort of a national system that we are all part of that is able to say who and who isn't vaccinated, is pretty absurd when you think about it. It sort of comes to me at some point of some of the hard ways that really impacted the vaccine rollout was due to insurers have records, the state has records. Apologize for my video. The state has records. Coordinated care organizations have records, but not all together. So that interconnectedness of someone's health record into how all of this has occurred, is definitely one of the challenges.
Yeah. Well, and again, you've already touched on this, but just last question. How do you manage now that there is plenty of supply but declining demand, and moving forward, what is the strategy?
Yeah, no, I definitely think that first and foremost, it's, creating more and more access spots. One, assuring that, basically every primary care physician or doctor's office, hospital node, et cetera, urgent care, I think some dental offices have access and have vaccine there. I think we're pretty close to getting to that point. So basically, the healthcare industry and pharmacies all have vaccine. I think we're pretty close to that spot, but that's not enough. And then I think it is really working on events, continuing them. I think moving to sort of a campaign ground game, which basically is, boots on the ground, knocking on doors, figuring out where there's lower uptake rates, and, just trying to make opportunities for people to receive a vaccine. And, that's hard, slow work. We're not going to have, we're not going to get back to where, we had 50,000 doses a day a couple of times. That's not going to happen again. It may when we need a booster, but or if we need a booster. For now, just keeping some still continued push of new people being vaccinated. We still have a long way to go in the state. Eventually, children under 12 will be eligible. So, we're definitely not done. We've come a long way, and I think we have hopefully a different kind of summer to look forward to, with cases that are really, really going down in Oregon and around the country. Hopefully that that more and more people will get vaccinated, so that we won't have a resurgence in the fall, or a resurgence with the new variant. But only time will tell.
Well, Dave, we appreciate it. You have a really hard job, and I know people are grateful for the incredible amount of time that you've put into making this happen. So again, thanks so much for carving out time for us, and good luck with the rest of the effort.
Yeah, thanks, Dave, and thanks again to the hospitals and health systems. Have been such important partners in the in this vaccine effort, and appreciate all that they have done.